Neet PG Grand Test Set 2 Questions 26 to 50. Question 26. A patient presents with cherry red discoloration of the skin and headache after exposure to smoke in a closed room. Which is the best initial management? A. Administer high-flow oxygen. B. Start intravenous fluids. C. Give sodium nitrite. D. Give hyperbaric oxygen. Answer. A. Administer high-flow oxygen. Explanation. The patient likely has carbon monoxide poisoning. Immediate high-flow oxygen reduces the half-life of carboxyhemoglobin and should be given without delay. Hyperbaric oxygen is reserved for severe cases. Question 27. Which is the first-line drug for generalized tonic-clonic seizures? A. Phenytoin. B. Sodium valproate. C. Carbamazepine. D. Diazepam. Answer. B. Sodium valproate. Explanation. Sodium valproate is effective for generalized seizures including tonic-clonic, absence, and myoclonic seizures. Carbamazepine is preferred for focal seizures, and diazepam is used for acute control. Question 28. In a patient with massive blood transfusion, which electrolyte disturbance is most likely? A. Hyperkalemia. B. Hyperkalemia. C. Hypocalcemia. D. Hypernatremia. Answer. C. Hypocalcemia. Explanation. Citrate used in stored blood binds calcium, leading to hypocalcemia, especially during massive rapid transfusion, causing tetany and arrhythmias. Question 29. Which is the most common site of intracerebral hemorrhage in hypertension? A. Pons. B. Cerebellum. C. Basal ganglia. D. Thalamus. Answer. C. Basal ganglia. Explanation. Hypertensive hemorrhages most frequently occur in the putamen of the basal ganglia due to rupture of small penetrating arteries. Question 30. In megaloblastic anemia due to vitamin B12 deficiency, neurological features are due to A. Myelin degeneration. B. Axonal injury. C. Neuronal necrosis. D. Microglial proliferation. Answer. A. Myelin degeneration. Explanation. Vitamin B12 is required for myelin synthesis. Deficiency leads to demyelination in the posterior and lateral spinal columns, causing sensory and motor deficits. Question 31. Which antibiotic can cause Achilles tendon rupture? A. Amoxicillin. B. Ciprofloxacin. C. Doxycycline. D. Linezolid. Answer. B. Ciprofloxacin. Explanation. Fluoroquinolines can cause tendinopathy and tendon rupture, especially the Achilles tendon, due to collagen degradation. Risk increases with age and corticosteroid use. Question 32. Which is the preferred treatment for anaphylaxis? A. Hydrocortisone intravenous. B. Adrenaline intramuscular. C. Antihistamine intravenous. D. Salbutamol inhalation. Answer. B. Adrenaline intramuscular. Explanation. Intramuscular adrenaline in the mid-anterolateral thigh is life-saving in anaphylaxis. It reverses airway edema, bronchospasm, and hypotension rapidly. Question 33. A patient develops hyperpyrexia, muscle rigidity, and autonomic instability after antipsychotic therapy. Diagnosis. A. Serotonin syndrome. B. Neuroleptic malignant syndrome. C. Malignant hypothermia. D. Anticholinergic toxicity. Answer. B. Neuroleptic malignant syndrome. Explanation. ANMS is due to dopamine blockade, often by typical antipsychotics, and presents with rigidity, hypothermia, altered mental status, and elevated CK. Question 34. Which is the antidote for benzodiazepine overdose? A. Naloxone. B. Flumazenil. C. Atropine. D. N-acetylcysteine. Answer. B. Flumazenil. Explanation. Flumazenil is a competitive antagonist at benzodiazepine binding sites on the receptor, reversing sedation. Question 35. A pregnant woman in her second trimester is diagnosed with asymptomatic bacteriuria. Which antibiotic is preferred? A. Tetracycline. B. Nitrofurantoin. C. Ciprofloxacin. D. Chloramphenicol. Answer. B. Nitrofurantoin. Explanation. Nitrofurantoin is safe in the second trimester for urinary infections. Tetracyclines and fluoroquinolones are contraindicated in pregnancy. Question 36. The earliest sign of increased intracranial pressure in adults is A. Cushing's triad. B. Headache. C. Papilledema. D. Vomiting. Answer. B. Headache. Explanation. Headache is often the earliest symptom due to stretching of pain-sensitive intracranial structures. Cushing's triad appears late. Question 37. Which heart sound is associated with mitral stenosis? A. Ejection click. B. Opening snap. C. Third heart sound. D. Fourth heart sound. Answer. B. Opening snap. Explanation. Opening snap follows the second heart sound due to sudden tensing of the stenotic mitral valve leaflets in early diastole. Question 38. Which drug is used for medical closure of a patent ductus arteriosus? A. Prostaglandin E1. B. Indomethacin. C. Sildenafil. D. Dobutamine. Answer. B. Indomethacin. Explanation. Indomethacin inhibits prostaglandin synthesis, leading to ductal closure in preterm infants. Question 39. Which type of hypersensitivity is involved in hemolytic transfusion reaction? A. Type 1. B. Type 2. C. Type 3. D. Type 4. Answer. B. Type 2. Explanation. Hemolytic transfusion reaction is mediated by IgG or IgM antibodies binding to RBC antigens, activating complement and causing cell lysis. Question 40. Which is the most common primary brain tumor in adults? A. Meningioma. B. Glioblastoma multiforme. C. Oligodendroglioma. D. Astrocytoma grade 2. Answer. A. Meningioma. Explanation. Meningiomas are usually benign, extra-axial tumors arising from arachnoid cap cells, more common in women, and often incidentally found. Question 41. In a patient with Addison's disease, skin hyperpigmentation is due to A. Increased cortisol. B. Increased ACTH. C. Decreased ACTH. D. Increased aldosterone. Answer. B. Increased ACTH. Explanation. In primary adrenal insufficiency, low cortisol leads to high ACTH, which shares a precursor with melanocyte-stimulating hormone, causing pigmentation. Question 42. Which cranial nerve palsy causes inability to look downward and inward? A. Third nerve. B. Fourth nerve. C. Sixth nerve. D. Optic nerve. Answer. B. Fourth nerve. Explanation. Trochlear nerve palsy affects the superior oblique muscle, impairing depression and insertion, especially when the eye is adducted. Question 43. Which is the most common cause of osteomyelitis in sickle cell anemia? A. Staphylococcus aureus. B. Salmonella species. C. Pseudomonas aeruginosa. D. Streptococcus pyogenes. Answer. B. Salmonella species. Explanation. Salmonella has a predilection for infarcted bone in sickle cell disease, though Staphylococcus aureus remains common in general population. Question 44. A patient with asthma is given theophylline. Which drug increases its plasma level and risk of toxicity? A. Rifampicin. B. Erythromycin. C. Phenytoin. D. Carbamazepine. Answer. B. Erythromycin. Explanation. Erythromycin inhibits cytochrome P450 enzymes, decreasing theophylline metabolism and increasing risk of arrhythmias and seizures. Question 45. Which vitamin deficiency causes night blindness? A. Vitamin A. B. Vitamin D. C. Vitamin E. D. Vitamin K. Answer. A. Vitamin A. Explanation. Vitamin A is essential for rhodopsin synthesis in rod cells. Deficiency impairs dark adaptation and causes night blindness. Question 46. Which is the most common complication of mumps in adult males? A. Pancreatitis. B. Otitis. C. Meningitis. D. Deafness. Answer. B. Otitis. Explanation. Mumps otitis occurs in post-pubertal males, leading to testicular swelling and possible infertility. Question 47. Which is the drug of choice for prophylaxis of rheumatic fever? A. Azithromycin. B. Benzathine penicillin G. C. Ceftriaxone. D. Amoxicillin. Answer. B. Benzathine penicillin G. Explanation. Long-acting intramuscular benzathine penicillin G every 3 to 4 weeks prevents recurrence of rheumatic fever. Question 48. Which is the most common cause of death in diphtheria? A. Airway obstruction. B. Myocarditis. C. Septicemia. D. Neuropathy. Answer. B. Myocarditis. Explanation. Diphtheria toxin damages myocardium, causing arrhythmias and heart failure, which is the leading cause of death. Question 49. A patient has a painless, firm testicular mass. Serum AFP and beta-HCG are normal. Likely diagnosis? A. Seminoma. B. Yolk sac tumor. C. Choriocarcinoma. D. Teratoma. Answer. A. Seminoma. Explanation. Seminomas are germ cell tumors with normal AFP and mildly elevated or normal beta-HCG. They are radiosensitive with good prognosis. Question 50. Which is the most common cause of acute pancreatitis? A. Alcohol. B. Gallstones. C. Hypertriglyceridemia. D. Trauma. Answer. B. Gallstones. Explanation. Gallstones obstruct the pancreatic duct, leading to enzyme activation and autodigestion, the most common cause of acute pancreatitis, followed by alcohol.